All right, so the first thing, in 1906, Robert Craig in Diseases of Swine stated that most stockmen have erroneous ideas about this parasite, and I think that still continues today, particularly with stockmen and even some of our veterinarians. And so the things you should already know, and some of you may not, is one is that Ascaris suum has a direct life cycle, but it has extra-intestinal migration, which becomes very important in your treatment decision-making. And one of the key things is that pigs do not have to be on or exposed to dirt to have Ascaris suum. All right, so that's an important point. Two, the female is highly fecund, and so she can produce 1 million eggs a day. And those eggs are thick-walled, highly resistant, and resistant to most of the common disinfectants that we're going to use in swine barns. And so there's a huge amount of environmental contamination that allows this parasite to exist, even in our modern-day barns. And lastly, they do exist. They are out in production. And I just, for my own curiosity, those of you that are in the room, how many you currently have farms that are positive for Ascaris suum and see it? Okay? So they are out there. They do exist. It's not PRRS, it's not PED, it's not SVV, but it is a pathogen that exists in our pigs. Just for quick reference, this will be in the slide sets and the proceedings, but this is sort of an updated life cycle of Ascaris suum. And again, with most parasites, it's important to understand the life cycle, because then you can understand what your treatment and management interventions can be that are going to be most effective. And one thing I want to point out is that work that was done in 2002, the earthworm is not an intermediate host for Ascaris suum. So another thing that we see with when we talk to farmers and practitioners, this idea that pigs have to be out on dirt or they have to ingest roundworms and that's how they get, earthworms and that's how they get roundworms is not true. So the 10 things that we want to talk about first is the eggs are not infectious when they shed. So there's a period of time where these eggs need to develop. They're shed directly as an ova, and then over a period, depending on temperature, humidity, and oxygen tension, anywhere from 4 to 12 weeks, they take time to develop into an actual infectious egg. All right, and so faster embryonation at higher temperatures actually results in lower infection rate. And so there's an ideal temperature of about 72 degrees, and in most farrowing houses, that would be ideal what you would want to keep the temperature. So the eggs are shed in the environment, and you've got about a 4-week period of time where they're not infectious. So normal processes that we have today of entering sows in a farrowing house, farrowing and lactating for 18 to 21 days is a pretty effective way to break that life cycle with really not a whole lot of other activity other than a sanitary process. All right, so it's really important to see that. The second, which is really important and not understood, I think a lot of times, is there's population overdistribution in a group of animals. And so basically a majority of the worms that are in a population are harbored by a very small percentage of the animals. And most of the animals that are infected don't have a very high worm burden. We're talking anywhere from 1 to maybe 20 worms, and then very few animals have a very high worm burden today. And so you're not going to see sort of this classic wormy-like pig, these huge massive infestations, and a majority of the population is not going to have any worms at all. And so this is important because it has an impact on your diagnostic methodologies. And work that a student I had did showed that oral fluids was more sensitive than pooled fecal samples in a barn to detect Ascaris suum, and it's probably just because you're doing environmental sampling, and that becomes more sensitive at the barn level than individual fecals. And then it also tells you that pooling samples, however you collect the samples, pooling is probably much more sensitive than individual sampling of those. And so it also probably has an influence on measuring the true production impact of the disease in a population. So the impact on growth finish is likely very minimal today. So the work that really we all go back to on the impact of worms in pigs was really done in the 1980s in small controlled settings, work done by Hale and Stewart, a lot of it's based on that, where they showed a 5 to 13% feed efficiency impact. And this was dose dependent, so increasing challenge dose of worms exposed, or pigs exposed to higher doses of worms had a higher impact. Most of that impact was seen during the migratory phase, not long-term development of adults living in the intestinal tract. But in larger field studies since then, we really can't see a large impact. Work that was done in Denmark would show that actually the impact was very negligible, if at all, and was much more severely impacted by other diseases like Lawsonia. All right, and then other work that was done in Canada would say that the maximum improvement, if you were to fix the problem, is estimated only at 1%. So we're probably overestimating what the impact would truly be in growth finish. All right? And again, it's probably related to this overdispersion. A small percentage of the population really has a really strong worm burden. What are the economics? So in the work that was done in the 80s and came out in 1988, this is referenced a lot in the literature. Stewart and Hale said the U.S. industry was probably somewhere between $87 and $155 million impact on Ascaris suum. And I tell you, that's a way gross estimate. Using that same data that they generated this off of in 1988, calculated the same sort of impact on a percentage basis, but using today's numbers on average daily gain and market weight and feed cost, etc. And this was done actually in May 2014 data, so the impact may not be as much as when this was put together. But you can see on an individual pig at an average infection rate using the same data that Stewart and Hale put together, it's about $13 a head. But if you assume 10 or less % of the population might even be infected that way, it quickly becomes relatively negligible, and then other diseases that we have, respiratory diseases, enteric diseases, are much more important. All right? But here's where there may be some future in this again, is that the USDA no longer cares about milk spots, but the packer themselves may. And the reason why is, well, the producer doesn't really experience this loss because of liver condemnations, because you're paid on a carcass weight basis. So anything that's not on the carcass weight is really lost by the packer. Well, the estimated losses of liver condemnations, and some of this data is a little bit old, but in 2004 in the United States, this was a packer survey that was done, estimated anywhere from 27 cents a pound on the liver to 30 cents per head lost to the packer. In the European Union, it was estimated at 18 to 31 euro, or that's calculated to US dollars, but 18 to 31 cents per pound. And actually in the Netherlands, there's a penalty back to the farmer if they have liver spots or milk spots. And then here's what's really driving it today, I think, the value of the edible products. So in the United States, liver is valued, or at least this data from 2011, valued at about $16 a hundredweight, but in China, as an export market, is valued at $51, $52 a hundredweight. Some data out of the Canadian Ag Group would say that value export market into China is about $5 to $6 million for livers. And then when we look at our data actually internally at Smithfield on what the value is, there's a 50% increment decrease in the value of edible livers down to inedible product, and then again another 50% increase if that liver has to be rendered. So the packer is more concerned about this than the producer would be, and the economic impact and the potential value, particularly in export markets. There's many secondary impacts, and I think some of this goes unappreciated or unknown in the discussion of Ascaris suum, but there has been shown pretty definitively that if you've got larval migration in the lung during vaccination with Mycoplasma high pneumonia, you have a decreased efficacy of that vaccination. In addition, we've got numerous respiratory diseases and secondary infections that occur: E. coli, influenza, Mycoplasma high pneumonia, erysipelas, PCV2, and classical swine fever, where the co-infection actually makes this disease worse. There's acute morbidity and mortality, and actually last year here at Leman, Dr. Colhane presented a case where they had massive acute mortality in growing pigs that were placed on highly contaminated sites. There's some evidence of reproductive effects, not specifically with Ascaris suum. More work has been done with esophagostomum in this, but there's potentially reproductive impacts to the sow, and then work out of, I believe this is out of Canada, meat quality impacts on large endoparasite infections. The risk of infection, so the growing site history, so finishing sites or wean to finishing sites, the history of having previously positive Ascaris diagnosis is much more likely than if the sow farm is positive. But in addition to that, management factors on the sow farm are very important for predicting association of Ascaris suum downstream. And so there's a very poor correlation between the sow farm status and the grow finish status when the wean age is less than 5 weeks of age. Again, because there has to be a time for development for those eggs to become infectious. So if you're weaning less than 5 weeks of age, you inherently break that cycle. Now, if you go above 6 weeks of age, it's twice as likely that you're going to develop Ascaris suum or ascariasis in growing pigs from the sow farm. In addition to that, Diagnostic history of the growing site was more significantly associated with whether growing pigs were positive at the end of the marketing phase versus wherever the sow farm was positive or negative. It was much more dependent on the finishing site. There's decreased association when sows are washed prior to farrowing and given an anthelmintic, which makes sense. There's a lower prevalence when sow herds wash sows, and there's anthelmintics alone by themselves are ineffective without sanitary and environmental changes. So you've got to really have both of those to decrease that risk of downstream production. There's immunity that develops over time with Ascaris suum, although it probably takes a lot longer than we give it credit for, maybe a year or even longer. And there is parity distribution within a farm, like most other diseases that we see. There is an initial mass expulsion of the L1s after an initial migratory phase. They get into the small intestine, and for some mechanism, they basically get excreted out of the pig, and a small percentage of worms may stay back in the intestine, or it may be complete expulsion of all, and then the animal develops immunity. In addition to that, there's another expulsion of adults around 23 weeks after post-ingestion, although this can last up to 50-plus weeks. And on a farm, there's definitive parity distribution. Gilts are much more likely have a higher prevalence of infection, and then your P1s, and then P2s and P3 pluses. So the importance here is if you're going into a sow farm and you want to survey and diagnose or check for ascarids, it's really the gilts and the P1s where you should target your sampling. All right. Timing of anthelmintic prior to infection, this is important. This is one of the parts of my master's degree that I did, is the pre-farrow anthelmintic treatment is common. All right, giving sows anthelmintic prior to farrowing to reduce that transmission, and that's the goal, reduce the transmission of eggs to the piglet. However, if we give this too close to the time we place them into the farrowing stalls or into a farrowing paddock, you can still have contamination of those facilities. And so people that deworm when we load into farrowing, that's probably not a very good strategy from a decreasing shedding standpoint. This is data, this is survival data based on different treatments that we did. This is the control group that was not treated, and gestating sows that were treated. And it's about somewhere between 10 to 14, 10 to 20 days is about when you get total negative status of all those animals that were previously positive. And this is data would be very similar for products like fenbendazole, parental, and dichlorvos when it was on the market. So really, your top dressing or pre-farrow and deworming needs to occur 2 weeks prior to loading into those farrowing facilities. Okay. There's obviously differences in the anthelmintic effectiveness, and this is just sort of a summary from a couple different places. These are the anthelmintics that are currently available. Dichlorvos recently taken off the market. The routes that are available, the larval stages that they impact, and so this is important. Understanding that there is extraintestinal migration. Using products like piperazine and levamisole to treat ascaris during a migration phase is not going to address the migrating larva. All right. And then in addition to that, you see there's variable efficacy reported in the literature, and then there's also some impact on the actual eggs. And so products like piperazine may have some impact on eggs still develop, but they may not be completely infectious when they're transmitted to the subsequent animal. The same thing occurs potentially with parental, and fenbendazole or the benzimidazole products are actually shown to be ovicidal. So the eggs that are shed never develop into an infectious larva. And then the relative costs. So using this information and what you know about your system and your timing, you should be able to develop a pretty effective control strategy for parasites. And then last is some data we put together a couple of years ago. There's always this talk about Peri-parturient rise, and it's very common in cattle or sheep and goats and cattle. And in swine, it's been documented in the stomach worm and Hystrongylus, which is I think it's the red stomach worm. But it's not a lot of data on Ascaris suum. So we did a project, and it was surprising in this. We have one individual animal that showed a Peri-parturient rise in lactation, but the majority of animals that were positive all the way through gestation. So this is the same exact animal sampled over time. When they get into farrowing, you actually lose that positive status. And the important part here is that some of the old parasite programs, for instance, like the old Intervet program, you would go in and actually sample in lactation. And this data would suggest that lactation is not where you want to sample. You'd want to sample in gestation. And ideally, through the work that we've done, the best thing to do is to go in and sample gilts and Parity 1 animals in that 2 to 3 week prior to farrowing period. And that would be your highest incidence of positive animals.